Okay, so I'll be talking about the deep layer muscles, the posterior leg compartment, and they are going to be comprised of the popliteus, flexor digitorum longus, tibialis posterior, and the flexor hallucis longus. Let's start with the popliteus. The popliteus is going to be originating at the lateral condyle of the femur. It's going to have an insertion at the posterior surface of the tibia above the soleal line. I'm going to draw the soleal line right there. So it's above it. And it's going to have an action of stabilization and unlocking of the knee joint. And its innervation is going to be the tibial nerve. We see here the tibial nerve is going to run all the way across all these muscles, and so that is the nerve that is going to be innervating all of these muscles. And so the next muscle is going to be the flexor digitorum longus, and this muscle has an origin at the middle of the posterior surface of the tibia. We see it right. This is the muscle right here, and as the name indicates, digitorum is going to have some action. It's going to induce something to these digits or toes of the leg, and so its insertion is going to be at the plantar surface of of these toes, 2 to 5, right? And so the action of this muscle is going to be the flexion of these 4 toes. The innervation is going to be the tibial nerve, and that will be it for the flexor digitorum longus. Adjacent to this muscle, it's going to be the tibialis posterior muscle. The tibialis posterior muscle origin is going to be at the posterior surface of the interosseous membrane, and it's going to have an insertion at the, this is the one that's going to have a really unique insertion, and I'm drawing it right now. It's going to be inserted right here on this bone, which is called the navicular bone, and this navicular bone has a tuberosity, and it's going to be called the tuberosity of the navicular bone. That is its insertion, and the unique action of this muscle is going to be inversion of the foot as well as plantar flexion of the foot. Its innervation, like I mentioned before, it's going to be the tibial nerve. Lastly, we have the flexor hallucis longus, and this muscle is the most lateral muscle. It's seen right here, as it shows. It's going to be retracted. It's the one that is retracted, and it's going to have the origin is going to be the posterior surface of the fibula, as well as the interosseous membrane, and it's going to have an insertion at the big toe, at the base of the big toe, the distal base of the big toe. And it's going to have an action of the flexion of this big toe, and it's going to be innervated like the tibial, by the tibial nerve, just like all the other muscles of the posterior leg compartment deep layer muscles.